Hi, I'm Samantha Pearlstein,
And I am Angela Lombardo.
and we are the Brigham and Women's Lung Transplant Social Workers. As social workers, we assist with many different aspects of your care, including coping with the impact of living with a chronic illness, approaching decisions around care, quality of life issues, identifying caregivers and creating a solid support network, connecting to local support and community resources, finding local accommodations close to the hospital and clinic, helping with transportation to clinic appointments, financial stressors and medical fundraising, substance use issues, returning to work, school, and applying for disability, and relationship and family issues.
We have a few different roles on the lung transplant team specifically, and we're going to focus on three of those today, including the initial evaluation, our inpatient role, and our outpatient role.
We will first start off by discussing the initial evaluation. Every patient who is undergoing a lung transplant evaluation must meet with social work for an individual assessment and support team meeting. Patients must have a support team consisting of 3 people at least. These supports need to be friends, family, or neighbors, and they cannot be anyone you are paying to be your support team. The initial evaluation will be 90 minutes long. It will first be a 1-hour meeting with you and your entire support team, where social work will give an overview of the lung transplant process, transplant recovery and hospitalization, and adjusting to life after the transplant. After the 1-hour support team meeting, there will be a 30-minute individual assessment with the patient and the social worker. If you live in Massachusetts, then the entire 90 minutes can be completed virtually with you and your support team and the social worker. The social worker will call you a few days in advance and give you the Zoom link and instructions on the upcoming appointment. If you live outside of Massachusetts, then you, the patient, and at least one of your support team members need to be in person at the hospital in the Lung Center C clinic. The rest of your supports can join by Zoom. Again, the social worker will call you a couple days in advance with the Zoom link and instructions. Prior to your evaluation, you will also receive some helpful links and documents, including a healthcare proxy and support team worksheet that the social worker will review during the evaluation. You can view them before the assessment and have them completed prior to meeting with social work.
Now we will discuss our role in the outpatient service. We see both pre- and post-transplant patients for a variety of reasons, including to follow up from your initial evaluation, problem solving with your support team, and further assessing for coping skills, substance use, unstable housing, and lack of support for adjusting for life post-transplant. If you need more ongoing support, we can help connect you with a local therapist. And again, if you live in Massachusetts, these appointments can be done virtually. If you live outside of Massachusetts, you must present to the Lung Center C clinic at Brigham and Women's. Now we will discuss inpatient assessments and our inpatient role here. As transplant social workers, Samantha and I follow patients when they're admitted here in the hospital, when they're on the wait list for transplant, immediately post-transplant in recovery, and when you're readmitted to the hospital at any time post-transplant. We provide emotional support to patients and their families during their time in the hospital. We assist with developing coping skills and can help you access resources if you need them. We partner with your medical team and coordinate with your family to ease the transition from pre to post-transplant. Whether it is Samantha or myself, you always have access to a social worker when you're admitted to the hospital.
Lastly, Angela and I run a monthly lung transplant support group for pre- and post-transplant patients. This support group takes place virtually by Zoom. It occurs the first Wednesday of every month from 2 to 3 p.m. Every month, there is a different topic. Some are more educational, where we have a guest speaker presenting on a transplant-related topic, while others are a more open forum, where we have pre and post-transplant patients and their supports who provide their own experience of what it's been like going through the transplant journey. In closing, whether we meet you pre or post-transplant, our goal is to provide support to you and your family as you navigate the transplant process. As long as you are part of the lung transplant program, you will have full access to social work services, so please reach out as often as you need.